Once every 7 days, you should change the dressing around the insertion site, the location where the catheter enters the skin. Your doctor or healthcare provider will tell you if this needs to be done more or less frequently. If your dressing becomes dirty, loose, or wet, you should do a full dressing change. You should not wait until the next scheduled dressing change to do so. The insertion site may have drainage and require dressing changes as often as every 3 days.
Now I'm going to start with showing you how to change a central line dressing. So the first step will be to wash your hands, whether it be using warm water and soap or using an alcohol-based hand sanitizer. Now that we've washed our hands, we're going to go ahead and clean our surface. In cleaning your surface, you'll want to put on clean gloves. And then we're going to use an antibacterial wipe to clean the surface that you're using. I'm going to allow my surface to dry, and then I'm going to wash my hands again. Before removing the dressing that's on, I'm going to put on a mask on me and the patient and anybody else in the room. Now I'm going to put on a clean pair of gloves. And I'm going to remove the old dressing. If you have an anchor piece on your dressing, that will be removed first. So I'm going to go ahead and start with that process. You're going to go to the center of the anchor piece and pull from one side, from the middle, and that should tear, allowing it to be removed easily. After removing the anchor piece, you'll discard that into the trash, and we're going to remove the main part of the dressing. You're going to use your non-dominant hand to stabilize the line. Then you're going to pull up from the bottom. So the old dressing and the chlorhexidine patch should all come off as one. And then you're going to discard that with your gloves into the wastebasket and perform hand hygiene before applying the new dressing. We're now going to open up our central line dressing kit. We'll remove the plastic wrapping and put that into the trash. Then you're going to place the dressing kit on your clean surface. And now's a good time to actually take a look at the dressing site before opening the kit to make sure there's no signs of infection. So you want to be looking for drainage, redness, or any swelling at the site. And I don't see any of those present. So if you don't, you can go ahead and move forward with the dressing change. If you do see signs, you'll want to call your medical team. Now I'm going to open my central line dressing kit. Your sterile gloves are right on top. You're going to set these to the side on your clean surface, and I'll show you in just a minute how to open those. I want you to keep in mind that this kit is sterile. So upon opening it, you just want to keep your hands on the outer edge. Nothing should touch the middle. And now I'm going to put on my sterile gloves. Keeping in mind again that you're only touching the outer edge. Remember that sterile gloves are oriented in the package with the palms facing upward and the thumbs facing out. You're going to put the glove on your dominant hand first. And remember that the cuff is on the outside is where you're going to put your hand first to open up the glove. Since I'm right-handed, I'm applying the glove on my right hand first. And you see that my hands here, my left hand is on the outer cuff of the glove, and I'm going to slide the fingers on my right hand straight in. Keeping in mind not to touch the palm or the fingers because those are sterile. Now I'm going to use my right hand and go underneath the cuff on the other glove for my left hand. And then turn my fingers upward. And I'm going to put my left hand slide that in just like so. Now your gloves are sterile and you'll want to go to the kit and not touch anything else. First step in the cleaning process is to use the chlorhexidine sponge, or you may know it as CHG. And you'll need to activate the sponge by pressing the wings on the side to get the chlorhexidine to go down to the sponge to wet the sponge so that you can clean. You'll hear a clicking sound when you press those wings together. And you can look at the sponge and actually see that it is wet. And now I'm going to clean this area of the skin underneath the dressing in a back and forth, side to side motion. I'm going to scrub, making sure to get all the areas of the skin underneath the dressing, making sure that you're getting around the insertion site where the central line goes into the skin. And you're going to scrub in this back and forth motion for 30 seconds. And after those 30 seconds, you're going to then throw away your chlorhexidine sponge. You're going to allow the site to dry. You don't want to fan the site or blow on it. Allow it to dry on its own. After allowing the skin to dry, we're then going to apply the chlorhexidine patch. You're going to take the patch out of the package and you're going to loosen it by pulling it apart, just like so. And then you're going to take the gauze that's in the kit. You're going to take the piece of gauze and grab the line. You're going to wrap the patch around the line. If you think of the patch like the face of a clock, you're going to turn it to the 5 o'clock position and make sure the edges are closed around so it makes a full circle. You can also apply it at the 7 o'clock position. It either needs to be at the 5 o'clock or the 7 o'clock position if you're thinking of the patch as the face of a clock. Then you'll throw that piece of gauze away. Next, we're going to apply skin prep. Open your package of skin prep. And you're going to paint this on in a window box type formation on the area of the skin where you know the dressing is going to be. You're only painting that window box on the outer edges. You're going to allow the skin prep to dry, and then you'll apply your dressing. Now we're going to apply the dressing. You're going to place your hands at the bottom of the dressing, and you're going to remove the backing on the top portion of the dressing. I'm going to place the dressing, making sure that the patch is towards the upper portion. You'll seal the upper part on. And now I'm going to remove the bottom portion. You'll pull the backing on the bottom portion straight down, stabilizing the upper portion with your non-dominant hand. You'll pull the line through and then seal the bottom. Now I'm going to apply the anchor piece. I'm not going to remove the backing on the anchor piece until I have it in place on the dressing. I'm going to pull the line up and place the anchor underneath the line to where the bottom of the anchor touches the line. And now I'm going to remove the backing. Secure the anchor. Make sure everything is pressed down. The main point of the anchor piece is to keep the line in place and have it not move back and forth, because if it moves back and forth, the dressing can become loose. The last step in the dressing change will be to write a date on the dressing so that you know when to change it next.
Some common questions that patients have include: what if I drop my dressing or other supplies? If you drop your dressing or other supplies, throw away the item you dropped and use a new item. What if my dressing becomes loose or dirty before the date it is due to be changed? If your dressing becomes loose or dirty, it should be changed, even if it is before the due date. What if I notice my stitches are loose? If you notice your stitches are loose, call your healthcare team. For any other questions or problems, contact your healthcare team.